We are marching through the horror of this moment. There's no way around that. With 10 times the cases we had just 6 weeks ago in this county. But today we're also marching through the hope of this moment. Second, it is the hope of this moment. To have witnessed the vaccines that we just saw brought a tear to my eye, because it shows human ingenuity. It shows the stubbornness that human beings have. We want to survive, we want to thrive, and we will make it through this. And that hope that we have today will only be hope if we can minimize the deaths and the hospitalizations before us in these next couple months. If we can bend this curve down, beat it down to the ground, as you have done so marvelously in this county. I just also want to dispel for any communities, because at the federal level and with a double check at the state, these vaccines have not been infected by politics. You can trust them. You should trust them. I trust them. And when my ticket is the right one, I will be ready, probably here at Kaiser with my family, to make sure that I do my part, to not only save lives, but to return our economy and our well-being and our prosperity and some normalcy to our lives.
I'm excited to be with you guys today. I'm even more excited to be a part of California's history as one of the first recipients of the COVID-19 vaccine made by Pfizer in the state. We frontline workers have been working around the clock over the past 9 months, sacrificing so much of what we do and love to take care of our patients. We've been doing this while trying to take care of our own families and keep them safe. What I want you guys to know is that help is on the way. Today's just the first step. Soon more vaccines will be distributed to the frontline workers and our most vulnerable populations. I also want people to know that the vaccine is safe, and when it's made widely available, I encourage everyone to take it so that we can get rid of this pandemic and get back to normal life. Perhaps the best way that you can support us nurses right now is to continue wearing a mask, maintain physical distance, stay home for the holidays, and wash your hands. We can't win this fight alone. We need your help to keep our numbers down and to slow the spread of COVID-19.
Today, 4 different locations in the state received vaccines. This was one of the critical sites. Over 17,000 vaccines are down in that ultra-cold refrigerator just downstairs here in the basement. In Southern California, down in San Diego, we had vaccines delivered, and of course up in Northern California at San Francisco General Hospital and St. Joseph Hospital, all the way up in Eureka. That's 4 sites today. 33,150 doses were received today here in the state of California. Part of the commitment from Pfizer to provide the state of California 327,600 doses. We are in the midst of the worst moment of this pandemic. So today is hopeful, and it's reason to be optimistic, but let's be mindful of where we really are in terms of this pandemic. California was one of the first states to create a safety advisory committee. We had 11 members, world-class members. They reviewed phase 1, phase 2 trials. They reviewed all the information concurrently with what was going on FDA and elsewhere, and they signed off on the safety and veracity of this vaccine unanimously. 3 members of our statewide scientific advisory group are also advising the CDC and the FDA and part of the national groups. We were joined by the governors of Nevada, Washington State, and Oregon in that safety review. They have independently reviewed the veracity of all the claims and unanimously have signed off on the efficacy and safety of this vaccine. I'm down here in the spirit that is this moment, enthusiastic that there is light at the end of the tunnel, but mindful that we're still in the tunnel and that we need to do everything we've done to date, which is we have outperformed a lot of expectations because many of you individually have done the hard work of putting on those masks, the stubborn day-to-day work of keeping your distance from others. Let's not run the 90-yard dash. Next month and a half will be challenging. If we get through that, there is light at the end of the tunnel, as I said, but there will be resiliency and renewal, and it will be remarkable growth for this state, and we know our nation.
Claudia Pisciuto of KNX Radio. Will the state plan to amend its coronavirus reopening system as vaccines become more widely available?
Yeah, we are iterative. We're not ideological, but for the moment, the baseline concerns remain that we're seeing substantial increase in community spread. We're seeing significant increases in total number of positive cases, and more importantly, perhaps the positivity rate spiking all across the state of California in every part of this state. For the time being, the new protocols we just put out, the regional stay-at-home advisories we put out, new protocols on enforcement from Cal OSHA and others will be effective. And as we move forward over the course of the next few weeks and months, we'll adapt based upon how this virus is adapting based upon the data and the facts on the ground.
Terry Sforza of Orange County Register. Will you, Governor Newsom, be getting the vaccine, and if so, when?
I will, whenever it's available to someone in my position, meaning I'm not cutting a line, not getting in the line. I have no problem taking the vaccine. I look forward to taking this vaccine. I'm confident in its safety and of its efficacy, but I'm not going to get in the way of any of the critical workers I see in front of me and the folks behind me that are more deserving. And until that is the case to all of those that are in need, get it, the most vulnerable, then I will not get in the way of that.